Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover low back pain and the contributing factor to low back pain of ergonomics. Ergonomics is body positioning that helps to promote efficiency and lowers the possibility of getting injured. Poor ergonomics is a huge contributing factor to not only low back pain, but many other types of conditions. I'm going to talk about ergonomics today, give some basic guidelines for ergonomics when you are laying down in a supine and in a sideline position, when you are at a computer workstation, when you are using a handheld device, and even when you are in the car. I already have done videos on ergonomics that I have on this channel, but please go ahead and watch those, because on those I get into a little bit greater detail than I'm going to today. I also have a video on the prevention of repetitive strain injuries, which is very common when someone works at a computer workstation for long hours a day. Also have a video on motions that can be performed at the computer workstation and another one on carpal tunnel syndrome. So please watch those videos. You're going to learn a great deal about computer workstation ergonomics and things that you can do to prevent injuries that occur from prolonged sitting and prolonged computer work. One key point that I want to make is no matter how good your ergonomics are, you still want to take a break and move. Our bodies are designed for movement. The human body is engineered for motion. We are not engineered to be sitting for long periods of time, sitting at a computer workstation or sitting in the car. No matter how good your ergonomics are, you still need to stand and take a break, even if that break is very short, what I like to call micro breaks. Take a micro break every 15 or 20 minutes. You can stand up, reach towards the ceiling, shift your pelvis side to side, anything of that nature, any type of movement, and then return back to your computer workstation, get in a good posture and get in a proper position. And then when 20 minutes go by, take another micro break. And then at the top of every hour, get up and walk around, even if it's for 1 minute. 1 minute to 5 minutes is even better. But what this does, it breaks the static positioning and prevents muscles from getting tight from the prolonged sitting. So please take frequent micro breaks every 15 or 20 minutes and take a short break every hour and get up and walk around during that short break. Ergonomics is the study of body positioning that promotes efficiency and lowers the possibility of acquiring any type of physical condition or injury. What I'm going to go over today are basic guidelines. Everybody is a little bit different. You could have people of the same height who have different leg length or different arm length or different torso length. So you always want to remember that. You have to find exactly what works for you. It may be the height of your chair, the depth of your chair, how you position the keyboard. There are so many different factors involved. So always try to fit your ergonomics to your individual needs. Ergonomics and body positioning while you are laying supine. Supine means face up. The pillow should hold the cervical spine. The cervical spine is the medical name for the neck. The pillow should hold the neck in line with the mid-back. The medical name for the mid-back is the thoracic spine. The neck should not be pushed forward into flexion or protraction by a pillow that is too high. The neck should not fall into extension or retraction by a pillow that is too low. The pillow should support the head and the neck. Always remember that. The pillow should be making contact with the back of the head and the back of the neck. The shoulders should be held to 90 degrees or lower. Never raise your arms overhead. And now, especially for low back conditions, the hips and the knees should be flexed. Place a pillow or a wedge under the knees and or the lower legs. There are several different types of wedges that you could purchase. Some place the lower legs parallel to the bed, and some place them so that the knees are angled a little bit more, and the lower legs are at an angle. So whichever one of those wedges works better for you, try them both, but use whichever one works better for you. Again, specifically for the low back, you want the hips and the leg and the knees to be flexed, and a pillow or wedge placed under the knees and the lower legs. This is going to help to lessen the pull on the lumbar spine from the psoas muscles, which are the hip flexor muscles. The psoas muscles originate on the lumbar spine, so it is very important to have them in a relaxed position when you are laying face up. Ergonomics and body positioning when you are side lying. The pillow should hold the neck in line with the mid-back. The neck should not be pushed upwards into lateral flexion by a pillow that is too high, and the neck should not fall downwards into lateral flexion by a pillow that is too low. The pillow should support the head and the neck. So what I'm saying here is that the pillow should be contacting the head and the side of the neck. The shoulders should be held to 90 degrees or lower. You never want to have the shoulders higher than 90 degrees. You should attempt to sleep on a non-affected side if you have pain or if you have a condition. Now, for the lumbar spine, hips and knees should be flexed, and a small pillow or leg separator should be held between the knees. Again, the hips should be flexed. You could do to 90 degrees or less, and the knees should be flexed. This means that the hips are bent and the knees are bent, and a small pillow is placed between the knees. There's also something you could purchase called a leg separator, which also is going to help to keep the knees apart from each other. This is a position that helps to take stress off the low back and the hip muscles. So if you're laying on your side, have your hips bent and your knees bent, and a small pillow or leg separator between the knees. Ergonomics when we are using handheld devices. This is something that is often overlooked. When you are using a handheld device, you want to maintain a straight spine. Do not slouch forward at the upper back. Hold the neck in line with the mid-back. Bring the device to the eyes. You want to hold the wrist in a neutral position whenever possible. Switch between using fingers and thumbs, and alternate between using the pads and the tips of the fingers and the thumbs. Anytime we are using a handheld device, you want to keep the spine straight. If you slouch forward at the mid-back, that puts an increased amount of pressure on the neck, the mid-back, and the low back. Keep the neck in line with the mid-back and bring the device to the eyes. Ergonomics while you are in the car. This is so important. Even if you drive a short distance, you still want to make sure that your seat is positioned properly. If you are driving a long distance, you want to take frequent breaks. If you can, take a break every hour or two and get up and walk around. Break the static position. This is going to help the low back so much and help to prevent low back pain if you take frequent breaks while you are driving. Walk around for about 5 or 10 minutes. Oftentimes, when we are in a static position from prolonged sitting, that tightens the hip flexor muscles, which are the big, powerful muscles in the front part of the hips. Those muscles originate on the spine. So if the hip flexors get tight, there's an abnormal amount of pull on the low back. This can create pain symptoms, including stiffness, dull pain, achy pain, muscle soreness, muscle tightness, a wide array of symptoms. So always take frequent breaks when you are driving. Your headrest should contact the middle part of the back of the head. You always want to use lumbar support. The hips and the knees should be at the same height. Ideally, the seat should be reclined to 100 to 110 degrees. The steering wheel height should not cause the shoulders to shrug or the arms to be held above the height of the shoulders. Hold the steering wheel at 9 3 or lower, and hold a loose grip on the steering wheel. Mirror should be positioning so that limited neck motion is needed. Computer workstation ergonomics. Like I said, I have a video on this that is on this channel, so please go ahead and check that out. But I wanted to go over it again in this video. You want to make sure that your chair size, height, and depth is ideal for your build. If you're using a chair that is an incorrect height, that is setting you up for a low back condition. Your neck and lumbar spine should be supported. If you have armrests on the chair, they should be soft armrests. The monitor height should be, the top of the monitor should be at eye level. If you are short or you have short legs, think about using a footrest. Footrest is ideal because it basically brings the floor upwards towards you. If you can, get a sit-stand desk where you are sitting for half an hour and then you are standing for half an hour. Now, obviously, when you're standing, you want to make sure that you're standing in good posture. You don't want to be slouched forward. You don't want to be bent forward. You want to stand in a good posture, just like you want to sit in a good posture. Again, take frequent breaks to minimize static positioning. You could do dynamic motions throughout a symptom-free range of motion during your micro breaks. You could stretch and drink plenty of water. Again, regular eye exams and corrective lenses are a necessity when you do a lot of computer work. You always want to sit and stand in good posture. The shoulders should never be shrugged. The scapula, which is the medical name for the shoulder blades, should not be protracted, meaning they should not be pulled away from the spine. The upper arms should be straight down and close to the sides while sitting. The wrists should be in neutral. Make sure that you have lumbar support and make sure that your chair size is ideal for you. Thank you everybody for watching today's episode of Dr. Ozello Sports Medicine Report, where I covered a contributing factor of low back pain, which is ergonomics. Body positioning is so important. Get yourself in a proper position and then also take frequent micro breaks and breaks to break the static position. Even if you are in the best position possible, you still want to take a frequent break to break that static positioning and keep the muscles from tightening. Again, thank you very much for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You could go to my website, championshipchiropractic.com, where you can get additional information on the book. Also on my website, you could find my blog. My blog contains articles on spine health, sports medicine, health, fitness, and nutrition. Thank you again for watching today's video. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. And always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.